Hello, and welcome to the Head and C-Spine course for the medic course offered by HPOP. My name is Brittany Hoover. I'm the athletic trainer for 1st Brigade. All right, let's just roll right into it. First up, we're going to review some basic bony anatomy. There are a lot more bones in the skull and face than just what's being shown in this picture, but that's a little bit out of the scope of this course, so we're just going to go over the basic stuff. In green, you have the mandible, which is the jawbone. The maxilla is the major bone of the face. The nasal bone is shown in yellow. It's important to note that the nasal bone is actually very small. You can actually feel the bone up here between the eyes. Everything else is just cartilage. The zygomatic is kind of the cheekbone in here. And the lacrimal, it's really hard to see. Let me see if I can circle it here. Lacrimal is that tiny little piece of purple in the inside of the eye socket, kind of where the tear ducts are, almost. The top bone up here is the frontal bone. It's really hard to break that bone, but it is possible. And you have the temporal on the sides and the occipital bone in the back. Last up for anatomy, we're going to go over the major muscles of the head and neck. First up are the paraspinals, which none of these pictures truly show that well. All of these really show the traps. Kind of here is where the paraspinals would be. Here's where the paraspinals would be. And just like the name kind of suggests, is the paraspinals are on either side of the spine, up and down in the paraspinals run up and down the entire spine, but there's cervical paraspinals, thoracic paraspinals, and lumbar paraspinals. This big muscle here is the trapezium. It's diamond shaped, obviously. There's the upper, middle, and lower trapezium. A lot of the times people tend to, when like bodybuilders, people who lift a lot, they tend to overwork the upper traps, which creates a little bit of an imbalance, which can cause some issues in the shoulder and possibly the neck. The sternocleidomastoid is shown here. That's what allows you to rotate your neck side to side. And one of the big ones that isn't shown is, let's see if I can clear off everything that I've done here. There we go. Is the scalenes. And it's kind of shown, it's everywhere that's not in red. So let's pick a different color like purple here. So here's the scalenes here. And underneath the sternocleidomastoid here, those are also the scalenes. That's a major muscle of the neck as well. You see a lot of things that involve the scalenes in terms of injuries. So in terms of evaluating a potential head injury, one thing that you want to do is clear the 12 cranial nerves of involvement. And we're going to quickly review how you do that, what each of the cranial nerves are, and how you would test them. The first one is the olfactory nerve, which is smell. You typically don't test that one, but if you were, you would test each nostril's ability to smell. The optic nerve is the second one. That's visual acuity. Pearl is typically how you test that one, so the pupil's ability to react to light. So you take a pin light, shine it in from the side, see if the pupil is reacting. You want to check both. Both pupils should be reacting to the light, even if you're only shining it into the one eye, or the left eye. The right pupil should also be reacting. Then you want to check both of them. So come in from the side, make sure the right pupil is reacting to the light, and the left side is also. You also want to check pupil evenness. If one pupil is more dilated than the other, that is a sign. Oculomotor and trochlear nerves both check eye movement, so their ability to open the eye, the eye's ability to look up and down, look side to side, and then diagonal as well. You want to do all of those motions, and that gets both the oculomotor and the trochlear nerves at the same time. The trigeminal nerve is facial sensation. So can you feel? You want to check both sides. Can they feel their cheek? Can they chew? Can they open their jaw basically? Abducens, same thing, is eye movement. So you're getting oculomotor, trochlear, and abducens all with eye movement. That's why you do all of the directions. Facial, have them smile. If the smile is uneven, the facial nerve is involved. Auditory, can you hear on each side? You can also check balance with that one. Glossopharyngeal is taste, again, usually not tested. Vagus nerve is the ability to swallow. And accessory is shoulder shrug. Hypoglossal is tongue movement, so you just have them stick out their tongue. And those are the 12 cranial nerves. There are a ton of different ways that you can remember those. There's one on here. There's like a Harry Potter one. I can't remember them all off the top of my head. As long as you remember to test all of these, that's really the only important part. If any of these are involved, that's a medical emergency. They need to go to the ER immediately. So continuing on with assessment, this page we're talking about facial assessment, not necessarily concussion assessment. So if you're assessing a potential face injury, some of the things you look for are discoloration. There's something called the battle sign, which is where you get a bruise right behind the ear. That's indicative of a skull fracture. You get raccoon eyes. It's kind of the same thing. You get bruises down here, and that would show up immediately. That's not like a black eye that you get 2 or 3 days later. A raccoon eyes would show up pretty quickly if there was a skull fracture. The photo down here, this is what's called halo sign. So if you have a patient that has a runny nose or has fluid coming out of their ears, you take a piece of gauze or some piece of fabric, whatever you have available that's clean and preferably white, and you blot it. And if there's that kind of clear fluid on the outside, that is cerebrospinal fluid, and there is a fracture somewhere that is causing the spinal fluid to leak out. Again, that is a medical emergency. They need to go to the ER immediately. Other things you can look for: swelling, deformity. We'll talk about evaluating concussions on the next slide. Inability to open eyes or smile. Again, that is you're checking the cranial nerves with that one. Palpation, be real gentle if you're suspecting a fracture, especially around the eyes where things are very tender. There's a lot of little bones in there, and if you push too hard, you can actually push the fractures inwards towards either the sinuses or into the eyes. So if you're going to palpate, be very gentle. You're looking for deformities, tenderness, things like that. We talked about halo sign, battle sign. If you are suspecting a C-spine, you want to palpate directly on the spine, looking for bony tenderness. As long as there's no bony tenderness, then you can start to look at range of motion, making sure that there's no neck involvement. If there is boniness directly on the C-spine, especially if that's accompanied by either loss of motor to either limb or to the legs, or loss of sensation, that is again a medical emergency. They need to go to the ER, preferably being spine boarded. So on this slide, we're going to talk about the different injuries that you can get, or the most common injuries that you can get in the head, neck, and face. Most common is concussion. The second most common is laceration, and lacerations in the face and on the head are very vascular, so there's going to be a lot of blood, even if it's a minor laceration, even if it's not, deep or needs a lot of stitches. The scalp and the face just gets a lot of superficial blood flow, so they bleed heavily. Control the bleeding, stitch them up, send them to the ER for stitches, whatever you need to do, but even minor ones bleed heavily. Orbital fractures, again, typically in this area. Mandible fracture, jaw fracture, zygomatic arch fracture, again, that's the cheek area. Down here, this is showing fractures of the maxilla. What is that called? That's called a Lefort fracture, and you have 3 different types of Lefort fractures. The first one is a fracture basically at the top of the teeth. That's a grade 1. A grade 2 is just above the nasal bone, doesn't include the eye socket. That's a grade 2, basically breaking the bottom half of the face. And then grade 3 Le Fort fracture is including from the bridge of the nose down through the eye sockets. Basically, the entire face is being fractured. That is a Le Fort fracture. The next one on here, this is actually incorrect. This is a sprain, cervical ligament sprain. So ligaments are sprains. A ligament injury is a sprain, and muscular injury is a strain. That's the difference there. You rule out a sprain versus a strain by palpating. So if there's bony tenderness directly on the spine, that's typically either a fracture or ligament involvement. Things that are more on the paraspinals, which is either side, more of that meaty part, that's going to be more muscular involvement, more of a muscular strain, or whiplash is the common term for that. So now we're going to talk about evaluating a possible concussion. Observation is a big one: disorientation, vacant stare, slurred speech, delayed response to questions, decreased coordination, and ability to walk straight, things like that. You're not going to necessarily always see all of these. Sometimes you'll see all of them, sometimes you'll only see one or two. It's important not to rule out a concussion just because not all of the signs or symptoms are present. A lot of symptoms that you'll see: headache, nausea and vomiting, dizziness, double vision or blurred vision, sensitivity to light and noise, and heightened emotions. Those are the most common ones, but I believe on the SCAT-5, which we'll talk about in a minute, there are 22 signs and symptoms that are listed. Headache, nausea, and vomiting, and dizziness tend to be the ones that I personally see most common, but we'll talk about more here in just a second. So here is what I just was talking about, the SCAT-5. That is on the civilian side of things, the most commonly used assessment tool for concussions. It stands for the Sport Concussion Assessment Tool, and it's the 5th edition, which is why it's called the SCAT-5. There are 22 signs and symptoms that are observed. You test concentration, memory, coordination, things like that. The military, you have the MACE-2, which is the Military Acute Concussion Exam, and it's the 2nd edition. Tests pretty much most of the same things. So when you're evaluating a head injury, you want to use some sort of concussion assessment, such as the MACE-2 or the SCAT-5. You want to check sensation of the limbs, so that's can they feel things equally on both limbs, including the hands and the legs. You want to check both. Do they have motor? So you want to do a quick, either have them squeeze your hand on both sides or do a quick bicep or tricep manual muscle test. Same thing with the feet. Can they wiggle their toes? Can they push up against your hand? Can they dig their heels into the ground? Whatever. You want to observe the cranial nerves. When you get really good at doing the cranial nerves, like the athletic trainer that is assigned to boxing at the Olympic Training Center, after every practice, they go through a quick assessment, checking all of the cranial nerves. You can knock it out in about 30 seconds when you get really good at practicing it. But you test all the cranial nerves, you look at balance, you look at cognition, things like that, to rule out a concussion, or rule in a concussion, obviously. So last up here is treatments. What can you do in the field if you suspect a concussion, head, neck injury, facial injury, anything like that? First up, you want to rule out any potential spinal injury. If you suspect a spinal injury, then that's 911. Immobilize them until ambulance can get there to spine board them or collar them or whatever their policies and procedures are. A lot of places are actually moving away from spine boards, regardless, not part of this course. Second up, you want to control any bleeding. And then for everything else, you refer them either to the ER or to primary care. Obviously, if you think they need stitches, if you believe there's fractures, if you believe there's a concussion, they're going to the ER. Those are all emergencies that need to be seen pretty quickly.